So let's talk a little bit about the underlying basis of the disease. So one of the troublesome aspects for those of us working in multiple sclerosis is our lack of an understanding of the cause of multiple sclerosis. It's almost an embarrassment when you look at what Dr. Coyle was saying about the fact that we're quite proud of the disease-modifying therapies and that MS is sort of at the leading edge of neurotherapeutics, and yet we don't know what the cause of this disease. I mentioned at the start that it's a disimmune disorder. We haven't proven that it's autoimmune. It behaves like an autoimmune disease, but there are rules for autoimmunity, and MS hasn't fulfilled them yet. We're not entirely sure of the immune mechanism of the damage. We're not even entirely sure of the target of the immune mechanism. And so, Pat, tell us a little bit what you think about the underlying damage that occurs between inflammation and degeneration.
So this is a very interesting concept because our ideas about the etiology of MS are evolving with genetics, environmental factors, and the host immune system. Initially, a number of years ago, if you were to speak to an expert, they would say that MS is most likely a T-cell mediated disease, that the person gets infected, it causes an immune response, there are activated T cells, there's something called molecular mimicry where the infectious agent shares antigens with critical central nervous system, brain and spinal cord myelin, and you get a cross-reactive attack by these systemic T cells of the brain and the spinal cord. But that simplistic picture has not really fully held up in MS at all. And in recent years, we appreciate that there's a very significant neurodegenerative component. This is not just an inflammatory demyelinating central nervous system disease, but there's loss of axons and neurons. And actually, that seems to be the substrate of the most disabling subtypes of MS, the so-called progressive or gradual worsening MS. So gray matter is a target. Axons, neurons are a target, a very early target, along with myelin. There seems to be independent factors that may be damaging the axons that are separate from myelin. We do come back to a recurring theme of inflammation playing a role, but there may be a different type of inflammation driving the neurodegenerative, the more disabling phase of MS compared to the typical relapsing macroscopic lesions in white matter phase. It's a very complex issue, but I'll just emphasize that we are learning more about it. We're asking smarter questions now.
Well, that's true. The science has been transformative. It just hasn't given us the answer yet, but it's told us a lot.
And if I could say something, I find it really fascinating too, because one of the things that we grapple with, and we're going to, I'm assuming, get into this when we start talking about the therapies, is the correlation between that inflammation, which is the acute attacks, versus the demyelination. And that correlation, although you think would be there, is sometimes hard to correlate. Acute attacks, what do they really do? You treat them, that's the acute attacks. Demyelination, the long-term effects, could be cognitive, ADLs, institutionalization, disabilities. And that's really hard, so it's a great point.
So it's more than the demyelination, it's actually the degeneration
Yes.
that Dr. Coyle was mentioning,
Yes.
that is the end product and the phases where we see the most disability. But as she also mentioned, the pathologists tell us that there is inflammation all along the course of MS, from very early to very late. And one of the things we'll get into when we get into treatments is that we've been very successful in treating that inflammation in the early stages and not so much in the later.